sought to combat sickness, and through the ages has progressed a long way in his knowledge of medicine. Every possible method of treatment has been tried, with a resulting accumulation of knowledge in the medical field. We have now arrived at such a very high degree of medical expertise that surgical operations upon vital organs of the body are now a common occurrence in hospitals throughout the world. Almost any illness we might have can be successfully treated, so that our confidence in the medical profession is well founded.
You say you've had this trouble for about 2 weeks, Pat?
Yeah, it's been about 2 weeks now. It was just an ordinary cold when it started. It just went down my chest.
Well, I don't think there's anything for you to be worried about at all. If you'll just get dressed and come into the office, I'll give you a prescription.
On examination, the doctor will usually be able to diagnose the cause of our troubles and prescribe a suitable treatment, often in the form of a medication. This little piece of paper is known as a prescription and must be taken to a pharmacist who will give us the necessary medicine to make us better. Most often, it is the pharmacist who actually provides the means for us to get well again.
Okay, Patrick, I've given you something here for your cough, and here's an antibiotic that I would like you to take for that infection you have. If you're not feeling better within a week's time, would you pop in and see me again?
Okay, fine, thanks.
There are thousands upon thousands of different medications in many different shapes, sizes, and colors. They come in many different forms, such as tablets, capsules, mixtures, drops, ointments, and injections, depending upon the method of ingestion chosen by the physician. In order to prescribe the correct medication, the doctor must have a thorough knowledge of therapeutics and the use of drugs. But the pharmacist has to have an even greater knowledge of all the drugs and medications which are available to a patient. To gain this knowledge, the pharmacist must have gone to university for 4 years to get his degree. 4 years of concentrated learning about all aspects of pharmaceutical products and their effects. A pharmacist cannot afford to make a serious mistake, so the teaching and the learning of pharmacy must be meticulous, clear, and thorough.
I would like now to discuss in more detail some of the courses that you will be taking during your first year. One of the courses...
First-year pharmacy at the university is a preparatory year. Here, the dean is giving a broad outline of the course and explaining how all the sciences relate to pharmacy in particular. So a student begins with getting scientific background in such subjects as organic chemistry, physical or inorganic chemistry, which involves the basic properties of molecules and their chemical and physical interactions. Students who study for a university degree in pharmacy soon learn to appreciate the importance of being absolutely positive in their work. Calculations must be checked, and measurements must be exact. Biology, too, is yet another of the many subjects which must be studied.
Both necessary for an understanding to enable you to appreciate courses in physiology that come in your later years. The physiology
All these different courses are taken along with other science students who will eventually specialize for different degrees. The first year is designed to familiarize students to the study and practice of pharmacy and its related sciences. But most important of all is the teaching of the fundamental principles of good pharmacy practice. It is first necessary to get accustomed to handling many different types of medicine and a wide range of apparatus. Students learn the elements of compounding by preparing mouthwashes, emulsions, and mixtures. The importance of careful and accurate measurement is emphasized time and again. One doesn't make mistakes where potentially harmful drugs are involved.
On the blackboard, I've written a typical prescription. And what I want to do is discuss...
The students also begin to learn a new area of vocabulary, medical terminology. New words and phrases, many of them in Latin, refer to standard dosage forms, methods of ingestion, and the names of the drugs themselves. A pharmacist has to be able to understand a prescription when he sees one.
And listed below,
A prescription must name the drug, the number of doses, the strength of the dosage, and the method of ingestion. From one little piece of paper, a fully qualified pharmacist is often able to deduce the nature of the patient's complaint, whatever the drug might be.
But some are still written in black.
In their second year, the students really begin to intensify their studies of pharmacy. The courses in dispensing teach them to make more exotic forms of medication. Here, a student is making some suppositories. Again, as in all dispensing, great care is needed when handling pharmaceuticals. The laboratory work also includes the dispensing of prescriptions using real drugs. As well as the practical experience, a student must learn the theory behind the making of acceptable pharmaceutical preparations.
It's what happens to the drug in the
Introductory courses in pathology and anatomy provide a basis for the study of disease and its treatment. For example, a disease called Parkinson's disease is known to attack the central nervous system. Not only must we know which drug will successfully combat the disease, but also what other effects a particular drug may have, not only on the diseased area, in this case, the central nervous system, but also on other parts of the body, such as bones, skin tissues, the blood, and so on. A course in physiology teaches the student about the functions of the body and its organs. Knowing how a healthy body works lays the foundation for the study of pharmacology. Obviously, we must know the normal function of the body and its parts before we can attempt to treat an abnormal condition. Drugs themselves must be studied. Students must learn to know thoroughly the products they are handling. The synthesis, chemistry, and properties of drug molecules are studied in detail, both in classroom lectures and in laboratory illustrations. The laboratory work is designed to complement the lectures in most courses. Thus, a student can prove for himself what he has been told in class. In the third year, courses have an increasing emphasis on the use and dispensing of drugs. A student works with real prescriptions, deals with problems over the telephone, and keeps family records. He learns to look for drug interactions, overdoses, and contraindications, and be ready to explain and adjust a patient's drug schedule when necessary, usually in consultation with the patient's physician.
Hello, Dr. Price. Yeah, I have a prescription for Sam Arnold for antabuse. Now, the dosage you have recommended is 4 tablets daily. The maximum CPS dose is 1 tablet daily. Okay, thank you.
It's important for a pharmacist to have a good working relationship with the doctors in order to give the patient the best health care. By now, he is nearly ready to enter the professional world of pharmacy, but he still lacks a full understanding of the use of drugs in therapeutics. He must take courses in pharmacology to study the effects of drugs in animals and man. Even an aspirin can have different side effects on different people, and a fully qualified pharmacist must have a good knowledge of the hundreds of different drugs and their possible effects. Further courses in biochemistry and microbiology must be taken in order to understand the effects of drugs on microorganisms, because a drug has 3 different types of effects, which all must be taken into consideration. Of course, there is the general effect of the drug on the disease, but then there is also the effect on the cells in the body and the effect on the biochemical processes within those cells. These are vital considerations for the research pharmacist. A study must be made of the mathematics of absorption and excretion of drugs in the body. This is called pharmacokinetics. Too little of the drug will likely be ineffective. Too much, and the consequences of toxicity or poisoning may be very serious. These calculations are extremely complex, and computers are used to assist the research pharmacist to determine the maximum dosage within the limits of safety. Further courses on the separation, identification, and estimation of drugs give a good, comprehensive understanding of analysis. The final year of pharmacy revolves around a core program of courses which teaches the student the therapeutics of disease and patient care. All the different courses that have been studied were given with one objective in mind: to teach a student to be a pharmacist with a deep concern for good patient care. To attain this, he must understand the problems and the pitfalls involved in the therapy of disease with drugs. He must know both the good and the harm that drugs can do.
What medication is this patient on?
He has been on chloramphenicol and acetylsalicylic acid. Do you think this could account for the bruising?
Are there any bruises elsewhere on his body, or anything else to indicate that he's having hemorrhaging anywhere else? Or?
He also had nosebleeds and passed some blood in his urine.
Now, the other product I want to discuss with you today is Dalacin C, and this comes in both
As an important member of the health team, a pharmacist must be prepared to update his knowledge as new products and new applications become available.
Now, if you just take off your glasses, I'll show you how easy it is to apply the ointment once you're shown how.
He must also retain good relations with his patients, whom he should advise how a drug may best be taken and used.
And pull it sideways and apply a thin strip of the ointment into the eye.
I noticed, Doctor, an order was left for formaldehyde to be added to the next Volutrol, this gentleman's IV. It's our recommendation.
At all times, a pharmacist is encouraged to consult with a patient's doctor whenever there's any doubt about the prescribed treatment.
Certainly, formaldehyde is contraindicated in any Volutrol.
There are many different careers from which a graduate pharmacist may choose, and different careers will dictate different additional studies. If a student wants to work as a community pharmacist, he can take a number of optional courses to provide him with the additional background he will need: accounting, managerial practice, and perhaps some knowledge of veterinary products. For those who wish to work with radioactive pharmaceuticals, there are courses available in the hazards, dispensing, and uses of these fascinating agents. Radiopharmaceuticals can be used to cure and also to assist the physicians in their diagnosis of certain illnesses. The potential hospital pharmacist is also well catered for, with courses in hospital administration, preparation and manufacture of pharmaceuticals, and training in highly specialized forms of therapy. Students who are analytically minded have a number of careers open to them. For example, the forensic division of the RCMP requires pharmacists who have specialized knowledge because of their training in analysis. The detection and analysis of poisons or other foreign substances is a specialized field, and extra training in new techniques are required. All analyses require meticulous attention to detail. This is particularly important when the findings and the results have to be presented as evidence in a court of law. In this field, as in other areas of pharmacy, it is necessary for the pharmacist to update his knowledge throughout his professional career, as new drugs are introduced and new techniques replace old ones. A few graduates will go into research and manufacturing. For them, there is a whole range of opportunities. For example, they may become involved in large-scale manufacturing or industrial research, which entails a high degree of quality control. Intensive study of all related sciences such as chemistry, physics, and pharmacology are essential to the research pharmacist. The development of all new forms of drugs and medications requires very specialized knowledge. And once a new drug has been authorized for manufacture and use by the government, the most exacting methods and strict controls are imposed on the manufacturing company in order to safeguard the health of thousands of patients who will use the new drug. All these different fields require specialization in the final year and after, but just taking the courses is not enough. A student needs to meet the public and work in a pharmacy to complete his training. An internship program in which a student works with a qualified pharmacist provides this experience. It is this experience which is most important because it helps to develop the confidence and the competence of the student, so necessary to the responsibility a pharmacist has to bear. This responsibility is developed mainly during the internship program, and it is important, not only for the 85% of graduates who will work in a community pharmacy, but the specialists, too, in their chosen line of work. The customer, or patient, is the central figure, the man or woman who needs the services of a qualified pharmacist. This man, for example, needs medicine, so he goes to the pharmacy just as if he were shopping for groceries. He doesn't think of pharmacy as being a profession. Like most others, he thinks only of the doctor's diagnosis of his own health problem and assumes the prescription will make him better.
From Winnipeg, a couple of weeks ago. Oh, nice to have you here in Edmonton, Mr. Hughes. I'd like to start a family record card for you, if I may.
Oh, what is that, then?
Well, actually, a family record card is a card that we make out. We keep a track of all the different medications that you and your family would get over a period of time. Now, by this method, we hope that we can prevent drug interactions or drug allergies, which may cause problems, you see. It only takes a moment to do. So
okay.
All good pharmacists keep a careful record of the prescription drugs a patient is receiving. Patients often go to more than one doctor, and the prescribing physician is often not aware of all the drugs a patient may be taking. The family record enables the druggist to check for allergies, drug interactions, and incompatibilities. This helps to reduce the risk of a patient suffering an adverse reaction from his medication. For this reason, it is advisable for a family to get all their prescriptions from one pharmacy.
Now, Mr. Hughes, is there any member of your family whom you know of is allergic to any particular type of drug?
Yes, as a matter of fact, my wife's allergic to penicillin.
Oh, that's useful information. I'll make a note of it on your card. Then, you see, if we have a prescription for her that contains penicillin, we'll know that she reacts badly to it.
Would she still get some kind of medication?
Well, in a case like that, we would phone the doctor and inform him of the problem. By the way, are you taking any other medication at this time?
No, not at the moment, but I've got a whole bunch of stuff at home. Can't remember what most of it is now.
Well, you know, it's not wise to keep old medications around any length of time, Mr. Hughes. Periodically clean out that medicine chest. Throw those old things out. And the best way is to just flush them down the toilet.
Ah, but if I get my cough back, I've already got the medicine at home. I don't have to come down here, do I?
Oh, that's true. But drugs that are kept over a long period of time tend to deteriorate and become dangerous or ineffective. What is the point of taking dangerous or ineffective drugs anyway?
You have a point there. I guess I'll clean it all out.
My wife's been after me to do it for an awful long time.
All right, Mr. Hughes, there's your antibiotic. And the directions on it are to take 1 capsule 4 times a day.
I see.
I would suggest that you take them an hour before a meal and refrain from drinking milk at the time.
No milk?
No milk. No, milk inactivates that drug.
Oh.
You're not taking anything for indigestion by any chance, are you?
Well, sometimes when I get a little heartburn, you know, I take these things, huh?
Oh, yes. That's an antacid tablet. And that also acts the same as milk and will inactivate the drug. So if you would just refrain from taking those an hour before or an hour after taking the tetracycline.
Okay. You mean that this cancels out that?
Yes, it does. It really does.
Really?
Now we'll get at your other prescription for you.
Hey, these are neat little bottles, aren't they?
Yes, those are safety closure bottles. They're to prevent your children from getting into your medication.
That's a good idea. I see you don't make them yourself anymore.
No, the drugs are so sophisticated in this day and age. Oh, we do make the odd ointment or the odd mixture once in a while for a doctor who wants a specific type of his own, but it's impossible to try and manufacture some of the very complicated medications of this day and age. Hi, Rick.
Hi. Excuse me. Remember those pills I had last week?
Yeah, well, just a sec. Hold it just a sec, Rick.
No, it's okay. No. Oh, lunchtime. Come on.
But, Rick, you only got those just the other day.
Well, my sister wasn't sleeping too well last week, so I gave her some of my pills, and I ran out.
Oh, no, Rick, I'm going to have to call the doctor and get an
This is probably the worst favor you can do for somebody. The pharmacist is explaining to the patient that what may be a good medication for one patient may be extremely dangerous for another. You should never lend your medications to anyone else at all. In an emergency, you must call the doctor. All prescriptions are individual to the patient and are dispensed only for that person.
No, and he'd like to have a few more. It's okay if I give him a few? Yes, I'll impress it for him. Yes, fine, doctor. Yes, I'll tell him. Thank you very much. Okay, doctor. Well, you're fortunate this time he authorized a refill on it for you.
Oh, good. Yeah, it's just that my sister wasn't sleeping last week, so I just thought it would be all right if I gave her some of my sleeping pills.
You must remember that prescribed medication is strictly intended for the person for whom they were prescribed and are not supposed to be loaned out to anybody else. Are these capsules helping you sleep a little bit better, Rick?
Oh, quite a bit. No problem.
Okay, Rick, there's your prescription. Just take it to the young lady up to the counter, will you? Sorry about that, Mr. Hughes.
Oh, it's okay.
Now, this is your cough medicine here. I would suggest that you take no more than 1 teaspoonful every 4 hours.
Okay. Yeah. Do you always give advice to all your customers, like to myself and to that young fella here just now?
If you have any questions that you have about your prescription medication or any of the medicines that we sell in the store, we're always glad to be of any help that we can or assistance that we can for you.
Well, you know, that's been very interesting. There's a lot of things I
In just a few minutes of talking with his pharmacist, this patient has learned a lot about his own health care. Like countless others, he had always taken the pharmacist pretty much for granted, with little or no idea of the enormous amount of highly specialized training, together with a personal concern for his patients, that a pharmacist needs to have. Although the modern pharmacist no longer makes his own ointments, cold cures, etc., he knows far more about the medications he dispenses than did the pharmacist of yesterday. He has more knowledge of doses, side effects, and anticipated cure. His advice is authoritative, for he must be qualified by a university and licensed by the government. The pharmacist really does have a big job to do. He is an important member of the health team that has, through pharmaceutical research, found cures and controls for diabetes, epilepsy, mental depression, pneumonia, malaria, arthritis, even cancer, and countless others. Whatever illness we may have can usually be cured or moderated with the help of our modern knowledge of pharmacy.